Okay, guys, welcome to another episode of Healthspan Academy. We are super excited to have our guest here today. This is Dr. Joanne Willoughby, and she's had an entire career of experience in the field of dermatology. So she actually is from Guelph originally and did her undergrad in pharmacy school at the University of Saskatchewan, and then worked as a pharmacy resident for a couple of years at Sunnybrook, and then completed her med school at Mac, and then went on to be a medical intern at University of Western for completing her dermatology residency through University in Toronto and Western, a joint program there. And she's worked since then as an assistant clinical professor in dermatology at Mac, and primarily her private practice over since 1990. She's got tons of experience. So we're super excited to have her here. Thanks for being here today, Joanne.
Thanks for inviting me.
Excellent. Well, I know most recently you've been working actually in COVID, and this is kind of a hot topic right now. So I want to hear a little bit of your feedback and experience working in sort of frontline and vaccination clinics and what that's been like for you.
Yeah, so I left full-time farming and retirement to volunteer as a vaccinator at one of the mass clinics in Guelph, and it's a really positive experience. It's the only time that I've worked in medicine where people wanted to be there and were so happy to be there that there was tears, and people are so happy to just have face-to-face conversations, albeit through a visor and a mask, but nonetheless. And as the weeks have gone on, the age group of people that we've been vaccinating has been decreasing. We're now vaccinating teenagers and the whole population, but it's a really positive experience. And the clinic has been so well thought out that, people aren't waiting, and there's enough one-on-one that people, everybody's nervous because it's been a year plus build up to it, but it's been a really good experience.
That's great.
And it's such an important move for our community, for people to get vaccinated so that we have protection against this horrible virus that so unfairly and indiscriminately can make people sick. That it really feels good to be participating in moving the community, helping the community move back into a new normal.
That's great. Yeah, it's a cool sensation when you have this sense of like synergy among the people and kind of like working towards that kind of an unfortunate situation, but it's been great to see kind of this uplift people and working together towards a solution.
You could see that worldwide more often, right?
Absolutely.
Yes.
Yeah. So I want to dive into something more specific to your traditional field in dermatology. And I know that we've talked over the years I guess we've known each other about 6 or 7 years now. And you've always been frontline when we're going away on vacation, making sure we're getting the right sunscreen and stuff like that. So I want to talk more about that background stuff there. And I think a lot of people are sheltered to what actually the consequences are when we get into that end stage in life, and like long term, what are we really doing by exposing ourselves to too much sun? What kind of damage? So what are the things that you see clinically that people should be aware of?
Well, so the first thing about the sun that people don't realize is that a lot of the changes that we ascribe to just natural aging are from sun damage. So the wrinkles that people get on their face, the brown spots, the so-called liver spots, the thinning of the skin, the fragility and easy bruising, those are not from biological aging. Those are from sun damage. And if you want to test it out, compare the skin on your forearm to the skin on your belly, and you'll be quite surprised. And if you really want to bring that home, look at an elder in your family and compare the skin on their neck to the skin on their chest. So it's quite surprising. And I mean, that's something that may or may not be a concern to people, but the sun is ultraviolet light. It's a class 1 carcinogen, comparable to the effects of smoking. And so as a dermatologist, one of the things that kept me busiest was looking at people who had precancerous lesions, especially in sun-exposed areas, and then all types of skin cancer. And you so rightly asked about end of life or later part of life, because that's when those are most common. But the scary skin cancer, melanoma, can show up much earlier on. In my practice, I had patients in their 20s and 30s who had melanoma. And so all of those are caused by sun exposure. The ones that you get later on in life, the basal and squamous cell carcinoma, are from a life accumulation of sun exposure, but melanoma is due to bursts of sun exposure and sunburns, especially in the younger years. So melanoma is a skin cancer that we see in fair-skinned, more highly educated and affluent individuals who have the desire to be out in the sun, and also the time or the disposable income to spend vacations out in the sun and get fried, and then unfortunately pay for it later on.
Right. Um, just sort of segueing on that, and this is something that just occurred to me, is you hear about the damages that we do from natural sun versus a tanning bed. I know those are typically frowned upon. They've gotten a ton of poor exposure, and I think a lot of it rightly so. What's your take on tanning bed? Is there any place for that at all, or what is your recommendation for people?
So
Yeah,
there is no place for a tanning bed.
fair enough.
The concept of a tan being a healthy um, finding on the skin is a myth that started in the early 90s. Before that, the fairer your skin was, the more affluent you appeared. And then we started to change, our lifestyle changed, and again, our disposable income changed. And we developed this false perception that a tan is something healthy and desirable.
Hmm.
But a tanning bed is basically just a form of irradiation.
Hmm.
And it's ultraviolet A, which is the longer wavelength ultraviolet light, which penetrates deeply. And it has been correlated with all forms of skin cancer, including melanoma. One of the unfortunate things about a tanning bed is that it's particularly fair-skinned people and younger people, who are also the people that have the most to lose from getting this exposure, that tend to go to tanning beds. So there is nothing healthy about it. I've heard people go because they feel that the light improves their mood, but it's actually visible light that has the dramatic effect on people's mood, not ultraviolet light. So,
Right.
and also it's the wrong type of ultraviolet light for making vitamin D. So there is nothing good about a tanning bed, and lots of harm.
Fair
I
enough.
could jump in here. I just have a personal or a question that occurred to me as well. I have a red light therapy device, and I try to get the benefits of the ultraviolet, the infrared lighting, without the UV kind of harmful side effects. Any words of wisdom or thoughts on that? Is that got a positive effect that you've seen over the years, or do you know much about it?
Well, infrared is the different end of the spectrum, and I'm not aware of a lot of evidence correlating infrared with skin cancer.
Right.
So it's, I think, a much preferable way of getting heat and warmth exposure without the risks.
Yeah, I just know over the winter time I got it because I'm not traveling as much, and I found 20 minutes in the morning like it really woke me up. It just promotes mitochondrial health from what I've learned, and it kind of gives you that little bit burst of light energy that you were talking about before, and just felt that'd be really cool to know your opinion on it. So appreciate that.
Yeah.
Yeah.
And the light and energy as well. I mean, a seasonal affective disorder is a common problem in northern climates like Canada, and there are visible light apparatuses that people can buy at a fairly reasonable price, and that can make a huge difference.
Hmm.
Yeah, absolutely. I'm addicted to my red light therapy,
Yeah.
and I'm glad to know it's not doing as much damage as those tanning beds. Um, cool. I want to segue a little bit into just continuing the discussion on sun. So, um, and this I think impacts people a lot earlier in life than a lot of them realize. So, what are the warning signs? What are the key things that we're looking for? You mentioned discoloration in the skin. Is there a specific protocol you recommend that people run through when they're looking for signs early on?
Well, I think that's a great question. And I think in general, it is a great idea for people to be familiar with their skin. I mean, we're paying a lot of attention to all sorts of things, protein intake, water, our bodies, we're trying to improve them. And I think um, getting used to your skin is a really good way of helping you identify if there's a problem. And it's not that I want people staring at their skin for hours on end, but if people have a bit of a routine once a month, just having a look at everything. So the front is easy to look at in a mirror. A side view looking at armpit and the side of the body, each side. Looking at the back is a little more tricky, but with a handheld mirror and a bigger mirror, you can do it. You have to look at all the unmentionable areas as well, like the groin and the cheeks, between the cheeks, and then the hands, forearms, and the feet, even between the toes. And the thing that people really want to just be aware of is their moles. Everybody has them. It's normal to develop new moles from childhood into midlife. And generally, people's moles should look like they belong in a family, just like you may look like your family members or not. And what you're looking for is an ugly duckling, something that stands out as looking quite different from what else you see on the skin, and is especially something that's behaving differently. So typically, moles are oval or round, they're symmetric, they have a border that's smooth and regular, they have a color that is uniform, and they grow and then they sit there. So if you have a mole that is asymmetric, if it has borders that are jagged or irregular, if it has many different colors in it, especially if they're asymmetric, or if the diameter is getting bigger, then that would be something to worry about. And nowadays, with cell phones with great cameras, if you're not sure, you can photograph moles with a little ruler beside it. So you can have that as a point of reference. And if you're not sure or you're suspicious, then go to your healthcare provider, family doctor, to have it checked. If one option is monitoring, and if there's anything suspicious, then it's a straightforward procedure to do a biopsy or remove the mole and have it checked. And if it is an early skin cancer, the cure rate is phenomenal. What's unfortunate is that if things are not detected early, the cure rate can be quite low, and especially melanoma is actually a leading cause of death in males, particularly, and also females in the ages of 21 to 29.
Wow, that's scary.
And the incidence increases over time.
Right. Great insight there. I got one more question for you, and then I'm going to pass over to Kyle, who I think has a few for you. So, on the topic of sunscreen, I find a tough topic to navigate, and you hear that occasionally you're doing more damage than good. How how do you decide an SPF factor, a brand um, that's going to work for you, and sort of navigating where you're doing more good than harm, I guess, when you pick something out?
So that's a really great question too, because it's not just sunscreen, it's a whole approach to the sun. I love the outdoors. I spend every day outside. And so even from a personal point of view, it's something that I had to work through too. So some of it involves planning, and if you can schedule being outside earlier in the day or later in the day, and not in the peak hours between 10 and 3, then that's great. And if you can arrange to be in shade, or even in your yard, if you can create a shade structure, that's really helpful. I don't love coating myself in sunscreen either. And so there's really great sun protective clothing. And I mean, you can wear regular clothing, but if you hold the clothing up to a bright light and the light comes through, then it's not going to give you as good a protection. So you want something that's a tight weave. Or there are products with a UPF or ultraviolet protection factor that are great. There's a lot of them in active wear, outdoor wear, and those can be good investments to just throw on, as a shirt or pants, and they're ventilated and they can be cooling, so you can cover yourself a lot. Um, and a hat. Sunglasses are important because the skin around the eyes is very delicate, but also ultraviolet light causes cataracts. So we want to keep our vision as we age as well. And then in terms of the sunscreen itself, on the areas that is still going to get some exposure, in terms of an SPF, I would look for something that's a minimum of a 30. The higher the sunscreen, the better broad spectrum protection you're going to get. The SPF is really just referring to filtering ultraviolet B. And so you want something that has that 30 plus, but you also want one that's broad spectrum, so that it'll filter and block UVA and UVB. And so there are organic sunscreens which have sunscreen chemicals in them that absorb the ultraviolet light and prevent it from getting into our skin. And then there are inorganic or mineral sunscreens, which would be titanium dioxide or zinc oxide. And we feel that partly they form a film on the skin and reflect the sun back. And so those are natural products. And for people who don't love the idea of putting chemicals on the skin, that's a good alternative. They can be a little more chalky to put on the skin. And especially if you put them on and jump in the pool, you can look ghostly for a while. But they do a good job of blocking the sun. And a combination of both is really good. You want a sunscreen that's photostable, because some sunscreen ingredients are actually degraded by sun. And so you may think that you're doing the right thing, but if then you're out in the sun and the sunscreen is neutered by the sun, you're not going to get the protection that you need either. And in terms of the substantivity of the sun, in other words, how it stays, you want one that's water resistant and sweat resistant. There's no such thing as a waterproof sunscreen. So if you're sweating buckets or you're in the pool or the lake or whatever, you do need to reapply. So there's a dizzying array of sunscreens that are available. The Canadian Dermatology Association does have a logo on some sunscreens that meet the criteria of being hypoallergenic, effective, and safe to use. So that's one indicator that people can use. The one thing that I would not recommend is making your own sunscreen, which is something, there's all kinds of recipes out there, but there was actually a study that looked at 15 homemade sunscreens and found that 3 out of the 15 had no SPF at all, and all the rest had an SPF of 6. So the last thing you want to do is to put something on your skin that feels like a great idea and you feel is going to be safe, and then get no protection whatsoever from it.
Right. You don't want that false sense of security. That's great.
Exactly.
That's good to know. Thanks, Joanne.
What about application, like reapplication, or like understanding that cloudy days that there's still UV? Like can you go online and see what the UV is for that day, and then kind of assess how much sunscreen you should use, or like any guidance just to give people a little bit more practical understanding of how much to reapply a sunscreen? Just talk about that if you don't mind.
Yeah, that's great. A little Canadian plug: the UV index was actually innovated by 3 Canadian meteorologists, and it's been adopted worldwide. So that's a really good guide, and it's available on most weather channels online. So that can be a good guide. The problem that I find is that we know this intrinsically, weather is always changing. And so you may think it's going to be an overcast day with a low UV index, and then all of a sudden, but the clouds break, and then it's a beautiful sunny day and you're stuck. So I think it's not a bad plan to assume the worst.
Mm-hmm.
And so the higher the SPF sunscreen, the longer it's going to last. That's what the number is. It's a calculation of how many minutes it takes to burn under a certain amount of light. So the higher the number, the longer it's going to last for you. And the formulation is important as well. So the spray sunscreens are really popular because they're not greasy and it seems quick and easy, but they're a bit problematic because you can't really tell what kind of coverage you've got. And so I see lots of people who, again, were trying really hard to do the right thing, but didn't get the protection they were expecting. So to get good coverage with a spray sunscreen, you actually have to spray it on until your skin's wet and then rub it in. So a
That's good to know.
lotion, you can sort of have more of a feel of how you're putting it on, and the zinc oxide and titanium dioxides, because sometimes you can see them when you put them on, even better. Most of those, the whiteness goes away after a couple of seconds of it being on. And you do have to reapply if you're sweating or if you're wet. Every couple of hours has been sort of the party line for as long as I've been in the business. But there is some evidence that a higher number, like 50 to 50 plus, will last for more than a couple of hours.
Awesome. Right on. Yeah, I know my first application of this every summer is, I try my best, but the complacency's set in since last year, and there's always a couple spots that I remember, oh yeah, I gotta really make sure I get, behind my knees and some of these other places. But
Yeah.
awesome. Well, I appreciate the insight there. Talking more about skin, sun exposure we've talked about, self-assessment we've talked about. What about just proactive things we can do on a daily basis that really can help promote and prolong that healthy skin? I just had some things jotted down here, like hydration, moisturizing, vitamin D, what our exercise diet, like what can you recommend to our listeners?
So in terms of vitamin D, just because we've been talking about it with the sun, um, it is an important vitamin, and as Canadians, half of our life we're likely deficient of it in the winter. So it's ultraviolet B that causes vitamin D to be activated to the hydroxylated form, which is active on absorbing calcium, um, and all the other good things that vitamin D does. So in the summer, it actually doesn't take much to get vitamin D. Nobody's really written out a definite equation, because the amount of vitamin D depends on the season, as I've just said. It depends on the time of day, whether it's overcast, if you're at altitude, if there's pollution. But it can take as little as 15 minutes on the forearms, at a midday 3 times a week, to produce enough vitamin D for us. So it doesn't take much. And although it seems like if you're wearing sun protective clothing and sunscreen and doing your job that you're not going to get any ultraviolet light, the studies actually show that we're not as good as we think we are at putting sunscreen on. And so even people who think that they're being really aggressive with sun protection get enough ultraviolet light through it to produce activated vitamin D. And you can also get vitamin D through some food sources, dairy products, fatty fish. There's lots of foods that are supplemented with vitamin D. And also, it's a pretty straightforward supplement to take a vitamin D. It's something that we should be doing in Canada in the winter anyway. So if you're really aggressive with your sun protection, taking a vitamin D supplement may be a good idea.
And how about measurement of your vitamin D? Any advice on just go to your family doctor, or I know Life Labs you can kind of go through and do like a virtual call with the doctor, get a prescription. I believe the vitamin D you have to pay for. I don't remember exactly, but do you recommend testing that once a year or twice a year? Or I don't know.
I
Or
don't think
just
that there's any evidence that testing for vitamin D is necessary unless you're at risk for vitamin D deficiency by virtue of an illness that you have. And in fact, as far as I understand, OHIP doesn't cover vitamin D testing
Mhm.
in people who don't have a risk factor. There's very little toxicity from taking a vitamin D supplement. So most healthcare practitioners would recommend just taking a supplement, which you can buy over the counter, and your pharmacist could give you some recommendation in terms of dosage.
So
Of
just in the winter time, kind of is what you're suggesting. Figure
Yes.
out okay. Awesome. And yeah, and then back to just anything else with regards to the healthier skin that you can tell us.
So I think a lot of us have learned through the pandemic that hygiene is, I mean, you can get away with less bathing and showering than we used to. And I think as North Americans, we do sort of overdo it a little bit. And so when you're bathing, it's important to use some sort of gentle cleanser on the scalp and face, armpits and genital area and the feet. But you certainly don't have to lather your whole body or use a loofah or exfoliate, because our skin does a really good job of turning over on its own without help from um, uh, the large industry of products that are available. And people frequently do experience dry skin, and it's interesting that people always think that it's a hydration issue. But our skin has a lipid layer on the outside, the stratum corneum. It's a compacted layer of dead cells, and the job of that is to keep moisture in and keep things that we don't want to absorb out. And it does a really good job. But if we're over bathing or using harsh products on our skin, then we lose that lipid layer, and that's what causes dry, flaky skin. So everybody genetically and age related has a different moisture factor to their skin. But most of us would benefit, especially in the winter, of using a hypoallergenic moisturizer on a regular basis. And then with all the hand washing and hand sanitizing, I think everybody benefits from hand cream from time to time. And there's
Awesome.
also a range of products. It's important with sunscreen and moisturizers to pick something you like, because if you like it, then you're likely to use it. And if you're not, it's likely to just sit somewhere on a shelf.
Right. Still talking about skin. I know acne is something that a lot of people are curious about. If there's any, some of my understanding is the gut is a major contributor there. But as far as the skin, or your kind of your view on it, do you have any recommendations or things to look for, just to help people generally with the acne?
So acne is a really common problem, and it seems to be a developed world problem, and we don't really yet have an understanding of all the factors that lead into that. But it's another really important topic because it can have such an effect on your self-esteem, and of course it affects people in their teenage years when that's most critical. And it's partly genetic, it's definitely hormonal, which is why it has its onset just before other signs of puberty. It's a highly treatable condition. And so if people have acne, it's well worth getting it looked after, because there's a wide range of treatments that can make the acne better, make people feel better, and prevent scarring of the skin. And diet is something that has always been discussed, and it's been very interesting over the number of years that I've been in practice to watch the ebb and flow and the popularity of diet. But currently, the feeling is that diet does have an important factor, and definitely the gut has such an influence on the skin and vice versa. But it seems that dairy products, particularly skim milk, and also uh, the glycemic index of your diet. So a low glycemic index diet seems to be more protective against acne than other type of diets. So that's sort of the current thinking, which is
Right
pretty
on.
general, but at least it gives people other things to work at.
Yeah, and the low glycemic index, like that's pertaining to sugar and carbs, like just more of a complex carbs, eating more like sweet potatoes, stuff like that in your diet is kind of what you're talking about,
Exactly.
right? Awesome. And then I'll just touch on one last thing. Still talking about the skin. I know eczema is kind of eczema is something that a lot of people kind of struggle with, and I know some people, again, it's a self-conscious thing. Some people don't want to get it looked at, or they just think it's them, or it's a problem that happens to them, and they're kind of this selected person that they can't do anything about it. Do you have any recommendations or thoughts on that as well?
It's a very significant and impactful condition to have.
Mhm.
Whether it's mild or severe or somewhere in between, it's an uncomfortable condition. It's itchy. It interferes with sleep-wake cycle. It can interfere with ability to focus, relationships. It's a really important condition to have treated, and I would encourage anyone with eczema to have it treated. And it can be triggered by something that you're in contact with, an irritation or an allergic reaction, which is where people tend to go to first. But it certainly can also be stress related. It can be an inherited condition linked with other environmental allergies and asthma. But there's excellent treatment for it. Again, starting with the basics of not overbathing, but regular exposure to water, using gentle cleansers, applying moisturizers directly to the skin while the skin's still damp is sort of a basic maintenance. And then there's a variety of other therapies that are available, and more exciting treatments for really severe eczema that are developing and starting to be on the market.
So I think the general idea basically is for a lot of these issues that people think that they have to live with is there's a lot of information, a lot of professionals out there, and we'll link to some of the stuff that you mentioned in our show notes to give people a little more guidance on where to go. And if there's any other information you want to provide as far as where people, that first stepping stone people can take, whether it's a family doctor, a specific dermatologist, anything else that you can provide for our listeners.
Well, so the Canadian Dermatology Association have a website, and in the website they have some basic information for people about different sun exposure, skin cancer products that they may be wanting about. They have a list of dermatologists that are available. The way our healthcare system is set up, the gatekeeper is your family doctor or nurse practitioner, and many of them are highly skilled. Eczema, acne, skin cancer are all common problems that they run into, and many of them are very capable of managing a lot of these problems. And then a referral to a board certified dermatologist would be the next step in a severe case or a difficult case, or lots of questions. There's lots of help available.
Awesome.
For people.
That's great. Joanne, I want to circle back to your personal habits a little bit. You've been super active since the day I met you, and like a absolute cardio monster at the gym. It's tough to keep up with you. So COVID's kind of changed the mindset for a lot of people around their own personal fitness. I want to know, and obviously we have a lot of things we have to focus on with nutrition and strength and conditioning and mobility. Where's your main focus been since the pandemic hit, and what have your habits looked like around that?
Well, I've been operating on the assumption that it's easier to keep going than it is to stop and start again. And so that has motivated me a lot. And I have really appreciated the community of Royal City and all the programming. So I do weights 3 times a week. And we, in the winter, we have a farm. So I was out cross country skiing every day I could. Now that it's summer, our family are avid road cyclists, so we're doing the 7 a.m. ride and gardening, planting trees, that type of thing. So I'm at a different stage than many gym members, being an older member, and I'm really working at maintenance, having had the privilege of examining bodies for over 30 years. I've been so impressed at the difference of aging, and quite aware of the muscle and bone loss that happens if you're not active. And so I don't want to go there. So I'm motivated to try and keep strength and conditioning up. And from a mental health point of view, it amazes me every day how much better I feel when I'm outside and when I'm exercising. So those kind of things just
It's great.
fuel it.
And I can attest to the fact that you've been defying aging since I've met you. So it's been a great discussion here today. Segueing into a reference. So what I wanted to ask is there been a really meaningful kind of lasting reference you've come across the last like 12 months, or something you can recommend to listeners that just a good read? It could be related to dermatology or health or fitness, or what's been something that sat with you and resonated well with you since we found ourselves in this pandemic.
I've been doing a lot of reading, but I can't think if there's one book that I would recommend. And the COVID and dermatology reading that has sat with me is unlikely to be of interest to most people.
Fair enough.
Um, I've really benefited from the weekly COVID updates that our public health group and family physicians have put together, and um, just really benefited from all the different community activities that, as we said earlier, have all sort of gelled together to move us through this.
That's great. Yeah. So I know you mentioned an article that's related to skincare. We'll link to that in the show notes as well. Well, thanks so much for being with us, Joanne. That was an excellent conversation that we had and a lot of insight. I learned quite a bit. We appreciate you being here.
Well, thank you for the opportunity to talk about something that's very near and dear to me.
Yeah,
Absolutely.
we
It was,
appreciate it.
it was a pleasure. Well, thanks for tuning in today, guys, on Healthspan Academy, and we will see you guys next time.